I am talking about skin conditions in your baby. And skin is the largest organ in the body, and it's really important that we look after our baby's skin. And in the early days, they seem to get so many different types of skin rashes, which can be really worrying for us as parents. Now, looking after a baby's skin is really important if we are to avoid some of the common skin conditions that babies get. Now, many parents will make the mistake of bathing their babies every single day. And baby's skin is very sensitive. And in actual fact, sometimes we do more harm than good when we bath our babies too often. So I would say to you to only bath your babies twice or 3 times a week. They're not dirty and they don't get dirty. But of course we do need to top and tail them every day. And that's what I used to do in the morning when I was getting them dressed. I would make sure that I wash their face and behind their ears and all of the little skin folds under their chin, especially if they're a little bit chubbier. And of course the nappy area and the groin area, make sure that we wash that thoroughly every day. But if you live in London especially, the water in London is very hard and it contains a lot of limescale, and we can see what it does to our kettles and our dishwashers and washing machines. So it's quite harsh on your baby's skin. So if you live in London like I do, I never used to bath my babies every day because the water was just too harsh. So today I'm going to talk about the 2 most innocent skin conditions in your babies, but they're very, very common. So within the first few weeks of life, a lot of babies will get milk spots, or milia as we call it in the medical profession. Now, I don't know why they're called milk spots, because they're absolutely nothing to do with milk. It is when the epidermis, which is the top layer of the skin in your baby, starts to shed, but instead of it falling away, it gets trapped underneath the skin and it forms these characteristic white cysts under the skin. And they call them milk spots because they're white in nature. Now, milk spots are quite innocent and they will go away on their own within excuse me, a couple of weeks. Some don't last that long. Now, there are a few things that you can do with it, but the most important thing is not to be tempted to pop them or prick them, because you will introduce infection that way, and then you'll end up having to go to your GP to have antibiotics and get it treated. But do wash your baby's face every day if they have milia or milk spots, and you can use some cool boiled water. If you are going to use a soap of some kind, it needs to be a neutral pH as much as possible, so you don't want it to be too acidic or too alkaline. So look for a soap that's got a natural pH in it to clean the skin. If you're a breastfeeding mom, breast milk is really fantastic. It cures a lot of ills within your baby. So you can certainly use some cotton wool and just stab it in the breast milk and pop it onto your baby's skin. So milk spots will pass in a couple of weeks. You don't need to go and see your GP about them, but they can look a little bit annoying for you and your baby, and they will be characteristically just over the nose and the cheeks. So if they do start showing any signs of infection, in that they're becoming red, inflamed or swollen, then you do need to go and see your GP for some treatment. Okay, so let's move on to the second most common thing that I see in babies, and particularly at this time of year, and that is heat rash or prickly skin rash. Now, this is caused because the baby's sweat glands become clogged up, really, because they just get overheated. Now, it's very characteristic in how you can recognize it. It's like a little red pinprick rash over the skin, and it's elevated off the skin. But it can also look like coarse sandpaper, and it elevates off the skin like a little blister almost. So these are the two characteristic ways that you will notice heat rash. Now, the treatment, of course, is quite simple. You just need to cool your baby down, really. So take off their clothes, open up a window, put a fan on them. What they really welcome is, sorry, I've got a frog in my throat. They really welcome cold compress, because that relieves the itching, and it can be itchy, prickly heat rash, unlike milk spots. So with the itching, you can use some calamine lotion, but with chamomile lotion, it tends to cool them initially, but then it gets very dry, and sometimes it can cake on the skin and be a little bit irritating to them. What I find much better is a home remedy, sodium bicarbonate, and if you use 5 tablespoons in a bath of lukewarm water, this I find is much more soothing for the baby who has got prickly heat rash. Now, heat rash should really go away within 3 to 5 days once the body temperature starts to cool down. But while your baby is having these symptoms, make sure that the clothing you're giving them, or putting on them rather, is natural fibres. So they all need to be cotton, because the skin is able to breathe in cotton. Avoid any kind of synthetics, so anything like nylon or polyester, because that just aggravates the skin and makes them sweat more. If it's the winter months, wool is fine because it's a natural fibre. But in the summer months, of course, just stick to cotton. So as I said, heat rash is annoying for your baby. It can cause them considerable discomfort. You can buy some hydrocortisone over the counter, and it comes in a very low dose of 0.05 or 1%, and that can sometimes soothe them as well. You don't need a prescription for it to be able to give that. And sometimes an antihistamine will help as well, like Piriton, but do speak to your pharmacist, because it's really important that you follow the instructions for Piriton. It can't be given to very young babies. But the natural remedies that I talked about will certainly help your baby and soothe your baby considerably. Now, I want to say one very important thing about skin rashes. If a skin rash develops very quickly and spreads throughout the body, or there's a high temperature associated with it, or your baby is very irritable or unwell, or if there's any sign of infection, please do seek medical advice. Because there might be something more serious going on. But with milk spots, you can absolutely manage them at home, and heat rash as well. Heat rash tends to be localized around the face, and certainly around the chin, and sometimes on the upper body. You can get it in the folds of the arms and the legs, but mostly I see it around the face and neckline. Now, if you do have any skin problems in your babies, I'm very happy for you to post them into the group. I have been a children's nurse for 15 years, and I have seen hundreds and hundreds of skin rashes in my time, both as a nurse and in my 15 years as a health visitor. So I can pretty much pick up a lot of skin rashes and reassure you, or signpost you if you need to see a GP. So I'm very happy to do that. Now, I might not get it right 100% of the time, neither do GPs actually, because sometimes babies will show up in the non-characteristic ways, but most of the time I can pick up most skin rashes. Now, tomorrow I am going to be talking about more skin conditions, and I'm going to be talking about scabies and ringworm, and these are really common also in babies but more common in toddlers. So I'm going to be coming in a bit earlier at 6 o'clock because I've got something else on at 7. I hope that's going to be okay with you. So if any of you want to tune in at 6 o'clock, I will be covering scabies and ringworm, but I've also had a couple of questions put into the group about sleep, so I will cover those questions as well. So until tomorrow, have a really lovely day, everybody, and I'll see you tomorrow at 6. Have a great day. Take care. Bye-bye.